So now today we will discuss the basal view of the skull, which is known as Norma Basalis. Okay, Norma Basalis is divided into three parts by two imaginary lines. One line is passing behind the posterior border of the hard palate. The other imaginary line is passing from the anterior border of the foramen magnum and the occipital condyles. Between these two lines, the Norma Basalis is divided into three parts: anterior, middle and the posterior parts. Discussing each part, in the anterior part what we can see is here. In the anterior part, as you can see, these are the alveolar arches. Alveolar arch contains sockets for the teeth. These two are for the incisors, this is for the canine, this is for the premolars, and these are the molars. So these are the sockets for the teeth in the alveolar arch. Medial to alveolar arch, what we can see is the hard palate. In the hard palate, anteriorly in the midline, we see an incisive fossa which leads to incisive foramen, which transmits nasopalatine nerve from nasal cavity to the palate and greater palatine artery from palate to the nose. So this is incisive fossa. Behind it, hard palate throughout is peated, having a depressions, multiple small depressions. The peated appearance is because of the palatine glands. Hard palate is formed by anterior 2/3 horizontal plates of maxilla and posterior 1/3 horizontal plates of the palatine bone. Between these two bones, we have a cross-like suture known as cruciform suture. This is the cruciform suture. At the posterolateral corner of the hard palate, you can see a foramen which is known as a greater palatine foramen, which transmits greater palatine artery and the anterior palatine nerve. This foramen leads forwards to a groove. This is a groove for the greater palatine artery. Behind the greater palatine foramen, we can see a small palatine crest. This palatine crest gives insertion to the levator palati muscle. Behind the palatine crest, we have a small foramina, maybe one, maybe two, maybe three. The small palatine foramina are known as lesser palatine foramina, which transmits lesser palatine nerves or the middle and the posterior palatine nerves. Behind this, we have a hard palate posterior border, the posterior border of the hard palate, which gives attachment to palatine aponeurosis. It is formed by the tendon of tensor palati muscle. In the midline, posterior border has a prominent part which is known as posterior nasal spine, which gives attachment to musculus ovuli. So this is what is the features we see in the anterior part. Behind the third molar, we have a tuberosity of the maxilla, maxillary tuberosity, which gives attachment to the superficial head of medial pterygoid. So this completes all the parts of the anterior part of the Norma Basalis.